That's exactly why I put that in the first
All
slide, so that
right.
this would happen.
Excellent. Thank you. Okay. Good morning, everyone. Yes, it will be recorded. So for those of you who can't make it through the session or say that it think that it might be interesting from coworkers or you want to review it one time because we didn't think we were clear or something kind of distracted you, so you think you missed something, it will be on our site and they get pretty quick. Within a day or two, we have them on our sites these days. So go ahead with the agenda for today, Kayla. Excellent. It looks pretty good. We have quite a few items. The welcome, of course, from me, Pete Vermeer. For those of you who do not know me, I've been with the MOTS system since forever and helping the team to work into the transition to the new roads team. So we have a little introductions, a little overview of who we are, why we do this, some updates, not that many. Mary will be talking about access agreement renewals because that's something that never stops and it keeps coming back. And Kayla will let you know about the administrative pause. Justin talk to you about some monthly client reports. We have a bunch of those and it's just nice to have a refresher. And of course, Jody, our EDI gal, who will talk about roads go live, roads provider update webinar, and all that great stuff. And then Kayla's intro to MOTS that we still do on a regular basis because roads isn't there yet. So we are working fine with MOTS and the standard switching from CE to EDI. Jody has that spiel for you. And we end with more questions and answers and some conflict information. And as if you have any questions, just put them in the chat and we'll see if they are interesting. Maybe other people would be interested in that question and we can bring it to the table, or we try to answer it as we go along, or if somebody from the team spots it and has the answer, they might respond to it right away. We'll see how that goes. It's I try to make it as interactive as possible and hope you that works for you. So, and if it doesn't, just let me know. So, okay, who are we? For those of you who are fairly new, as you can see, Kayla Camelli, our MOT system administrator and Rhodes product owner. And product owner is kind of the same thing as a system administrator, but maybe a little different. But it's a new product, so we come up with new terms. So, Cecilia, you might have heard if you have any questions, submit it to the MOTS mailbox. Myself, Pete Vermeer, senior systems analyst. Mary, also with Cecilia, doing a lot of support and a lot of help for everybody. Jody, our EDI technical expert. Justin, our report specialist, and Anna, also a report specialist. So that's the gang that we have. Okay, why do we do this? Well, you probably figured that one out. We try to give information. It is currently MOTS is not a live, it is a live system, but and we recently had a little change. So whenever there are changes or enhancements or things that are state government or legislature or a federal change comes that we have to push through the system, we'll bring it to you as soon as we can with all the parts of the information that we have sending to you. And this is the webinar is one of the tools that we use. So we always love to talk about data, or I love to talk about data. Not everybody agrees with me, but it's one of those things that we can make tangible. You can have the numbers, you have the information, and you can see if there's something numbers are dropping or some information is looking like it's not right. Then we'd like to put it on the table so you can check back within your organization, and maybe there's something changing in the behavioral health world, in the treatment world, and we should adjust our system. So if you have any feedback, any questions, this is a wonderful platform to use it. Ideas for future webinar topics. We'd love to hear that from you, and we can maybe um, devote devote some slides to it and explain it to in a more broader way, or come with more examples, or work on it to um, make it more clear for everybody. And as I mentioned earlier, answer any of your questions that you might have. Kayla? Okay, the news update. As I mentioned, there's not that much news happening at the moment, but maybe you missed last month's webinar and you didn't hear, but we're currently in the Resilience Outcomes Analysis and Data Submission System, the ROAD system. I like that name, the ROADS. Development cycle 4 is happening now. We work in a process that is in a cyclical manner. We have things that we call sprints and cycles, and we try to cut out a certain piece of time to get a certain amount of work done. And if it's not done, then we try to finish it in the next 4 weeks. And then there's cycles going on, and it's a new way of developing systems. In the olden days, you had everything written down to the T's, and then you gave it to your development team, and then 6 months later or a year they came back and says, there you go, this is what you asked for, and then you go back and forth and back and forth and back and forth. Now we are doing it in a different way. We, as you are well aware, MOTS has many different segments, so we can kind of work one segment at a time and kind of build on the system to make it complete. So currently we're in cycle 4, and and the go live is April 2024. That's what we're striving for. So there are provider webinars upcoming, and you'll hear about that a little bit later. The administrative pause ended October 1st. We mentioned that a little while ago. So for those of you who missed it, and we'll get some more details about that as well, if you're wondering what administrative part was paused. And the mod support did change to the odhsoha.oregon.gov. They all were .state.or.us, and they've all been changed. If you still have the old one somewhere in your mailbox, in your contact list, then it'll find its way. But we have changed. The whole state has changed to .oregon.gov. So that goes for mods and for roads. Thank you, Kayla. And I think I'll hand the microphone to Mary, talking about access agreements. Go ahead, Mary. You're still muted, Mary. There you go.
Okay. All right. Thanks, Pete. So access agreements, in order to process information from you into MOTS and for us to submit the information that you processed back to you in reports, we need to have access agreements. And right now, there are the Office of uh, Information Security and Privacy Office are going through their access agreements and updating any the language in the agreement. And this means that you may need to sign a new access agreement form. I will be if every 2 years the access agreements are renewed. And so I generally reach out to you and say, this is what's on, this is the people on, has the contact on the access agreement. Is this still correct? And you send it back to me and say, yeah, everything's the same, or no, this has changed. And then I send that information to Information Security Privacy Office, and they update the access agreement. However, right now there are a few access agreements that the language needs to be changed. And if that is the case, they'll reach out to you and, uh, with the new context and everything in new language. And those access agreements, when they send those to you, those need to be signed and sent back to you, to them, and then they'll send it back to us for our signature, and then they'll be good to go for another 2 years. So just if you see an email from us or from ISPO, about access agreements, please, it would help if you're able to respond in a prompt manner. So, thanks, Pete.
Thank you, Mary. I saw a little pop-up of a request for going back to the screens, but I thought maybe Kayla can make a copy of the PowerPoint and put it in the chat so you have all the slides and you don't have to make screen prints or anything like that. So thanks, Kayla. Okay, well, back to Kayla. Administrative pause update. Go ahead, Kayla.
Thanks, Pete. I am just going to review this administrative pause update. I know we've talked about it before, but since October 1 is long in the past, regular MOTS reporting is back on the table. So that means clients are submitted within, or new clients are submitted within 7 days of admission, crisis events and involuntary service events also within 7 days, non-Medicaid services. And Jody, I think for EDI, y'all are on a different cadence than this. And I think it was by the 15th of the month after the month of the service.
Yes, yeah, that's correct.
Okay.
That's correct, Gil.
Great. So if non-Medicaid service occurred in October, we would expect to get that by no later than November 15. The status updates, we will still, at a minimum, ask that you provide them every 90 days. We always, as Pete said, we love data. So the more data we can get, the better. So if you want to do it every 30 days or every 60 days, that's great. We'll accept it.
Once a week?
Yeah, sure. And then we ask that you let us know when a treatment episode has ended within 30 days. And that's all I have about the administrative pause ending. I'm going to pass it back to Pete.
Thank you, Kayla. Yeah, as Kayla mentioned, we love our data, and we know that quite a few of your EHRs have a routine, a rhythm set up in a weekly manner or a monthly manner. And the reason we prefer it on a shorter notice is that it prevents errors. And if there are errors, then usually the list is smaller because you submitting the data in smaller increments. If you wait 90 days, your error list could be quite substantial, and it makes life a bit harder. So if you can do it within a week and have 1 or 2 issues, fix them right away, and then you're good. Within 90 days, you also might have the issue that an individual was closed and reopened, and if you get those mixed up because they kind of disappeared, but within the 90 days they showed back up and said, yeah, no, I really need to continue this treatment. So, and then you start a new treatment episode for the individual and you hadn't submit the closed one yet, and they kind of get mixed up, then this can create all kinds of errors. So within a shorter time frame, a more frequent update to us usually works a lot better. And it's used from what we've heard, and Jody told me a lot, is that a lot of the systems really like it to have it in a kind of like manageable chunk. So, okay, thanks, Kayla. Justin, MOTS monthly client reports. Go ahead.
Yep, that's me. This is just a brief review of the standard reports that the system generates and sends out. We've got 2 types, one for the facility primary contact. One type will be the active client monitoring report and the anomaly reports. Active client monitoring is all your active clients, and the anomalies we've talked about before is this stuff that just looks a little bit weird. In fact, the active client monitoring report is running right now. Some of you should be seeing that in your inbox very soon. The other type is the agency primary contact. We've got 4 of those. 3 of them are summaries for non-Medicaid services, crisis, and involuntary service data. And the other one is the performance report. That's the pie chart that shows how frequently the clients have been updated in terms of volume. And just a note on these, they're locked down to 1 recipient. It's just the way the system was designed. We don't have any control over that. So if you are the facility primary contact, you are the only person who will receive the active client report. If you're the agency primary contact, you are the only person who can receive the performance report. You are welcome to share those around your organization, but we can't add multiple recipients. We can do that for custom reports, but not for these standard reports. So if you are not receiving these and think you should, please let us know. We'll look into that. And if there's any other reports that you would like to receive, also let us know. Anna and I are standing by to write queries for you as needed.
Excellent. Thanks, Justin. Okay, and then we start with the Jody show. Roads go live date postponed. Oh no. Go ahead,
Awesome.
Jody.
I will be the bearer of, we won't call it bad news, we'll call it updated news.
There you
So,
go.
yeah. So, as most of you know, Kayla Camilli and myself are the product owners on the new roads system, which is essentially MOTS brought into a new modern platform and enhanced upon what was already working for MOTS, and then adding to things that maybe we didn't have the capacity for and things like that. So the deployment date has been pushed to April of 2024. Many of you have probably heard that. And you can kind of see this slide. There was a lot of decisions around moving it. Some of the big ones in that effort to reduce administrative burden on providers was the inclusion of data collection for the 988 stabilization services. They kind of are another service that sometimes gets offered to certain groups of folks that have maybe received a mobile crisis. They need some stabilization services so they can get into some more permanent treatment. And also Measure 110, that is, a new program that's been out there. Not any way to collect it in the way that roads is going to be able to. So knowing that you all are EDI and you all are utilizing some EHR of some sort, I see many of you on here today are using ones like Dr. Cloud, CareLogic. I also see Credible, Ocean Epic. So we wanted to put out the EDI new roads specifications documents, which we're calling version 2, because when we go live in 2024, we are going to be accepting your MOTS legacy version, what we're calling 1, into the road system. So upon go live, you're still going to run your reports out of your systems. You're still going to utilize your same SFTP. The biggest difference, which hopefully you won't notice, is that roads is going to be communicating with your SFTP directories and picking up your files and processing them and then giving you back a results file, just like MOTS did. And so roads will accept both versions in an effort to for the EHRs and for those of you that have in-house IT teams or others that are going to be modifying what you send from version 1 to 2. Including all of those was really the preference from the EHRs and us, because we didn't want to put out version 2 and then in 3 to 4 months later we're pushing out version 3, and now you're trying to work 2 projects and 2 things with your EHR to get all of those in to the road system. So with that being said, the date for those documents that your teams or your EHRs will need has been moved as well. We do not have a definitive date. We are looking that it will be before the end of the year. And I am unofficially trying to shoot for the end of November to December. With that being said, we also have been in contact with Dr. Cloud, Ocean, Credible, Qualifax, CareLogic, Reliatrax. So if any of you have an EHR that I didn't speak of, because I know there's a lot of other ones out there, and you are concerned that they may or may not be in the loop of information, please feel free to reach out to them to get them connected to myself and Kayla. And we are happy to communicate with them. Or if it's your internal IT teams or you're the one doing it, we can always talk with you as well. So like we did that for one of the large counties. They do a lot of in-house stuff. So we chatted with them. We know that everybody, there's some anxious to get this transition underway. But we felt like pushing that date out would give that inclusion for the documents and also would give your
Think we lost you there, Joni. Something, your
there we
microphone.
go.
Yeah.
Sorry,
Okay.
I'm
You're
back.
back.
Yeah.
Thanks.
So basically, once the documents go out, we as the Compass team here and Rhodes team will be working in collaboration with you and your teams to go as they're going through the documents, if they have questions. So we expect a lot more interactive things on a more frequent cadence once those go out. And we will also be talking with them and yourselves about timeframes, because you might be thinking, oh, geez, do we have to have version 2 done by April of 2024? Well, in a perfect world, it'd be wonderful if we could all have version 2 ready to go. That is, that's just very not probably super realistic for the body as a whole, for the EDI providers. So we'll be working with you all to find out, are you, 3 months, 6 months, a 12-month window? Where are you at for your dev times? Can you develop up in phases? Maybe you can get part of V2 in because version 2 built upon version 1. So you all will see that there's some changes and there's some new things, but it's not a complete overhaul where you're starting from scratch. So I think I probably belabored that a little bit. Any questions in the chat around this topic?
I did not see anything pop up, but
Okay.
There is one
oh
question
yeah.
Okay.
From Salem or
Yeah. Okay.
I'm not.
Okay.
Are you saying
So
that Rose will also assist in collecting M110 data?
yes, that is correct. And Salem, I believe you are with On Track, if my memory is serving me correctly. Um, like, yes.
Yes.
Okay.
Yes.
Perfect.
Yep.
My caffeine has kicked in.
There you go.
So yes, so measure the additional things that are going to be collected, such as Measure 110. We have been working with OHA, Oregon Health Authority, program staff here that are helping to administer the Measure 110 program. And also our business analysts and data analysts within our Compass team, as well as our business information systems and health analytics at OHA, to make sure that we at the Rhodes Project are working from their most current data dictionary that they're currently developing. We do know that Measure 110 at the moment is being collected through a survey type tool called Qualtrics. Measure 110, I would, once the documents come out for EDI, all of those fields are going to be in there. And these are things specific around the different, like harm reduction, the different service categories that are available that Measure 110 providers that are within a particular, they're calling them burns, like a behavioral health resource network, I believe is what the acronym stands for everybody on the call. And some of you may be within one of those burns for Measure 110 and were contracted and awarded to provide certain services for clients. That will be available to come in through your EDI file as a new data segment for those of you that are familiar at all with the file itself and the segments of data that come in for a client or combinations. You'll also be able to put Measure 110 in through the Rhodes portal And we are working on, there's improve options for non-EDI data submissions. So what we've done is we've also, for some of you, we've had other EHRs that have not built all the way out for the full EDI, but they've said, hey, is there a way, you know, that we could have a business analyst or intelligence person populate that? So we're creating what are called templates, and you might hear when you attend some of the upcoming next slide I'm going to talk about. Drag and drop is what we're calling it, but they're essentially templates that you'll be able to have somebody on your technical side or somebody with business reporting that can populate that per the instructions and then be able to upload that or drop it in the portal. So we're kind of working on that as well. So that's probably a lot of information. But for those of you that are with a larger, like an EHR that's submitting data, like maybe Dr. Cloud or whatnot, we have been letting them know as well that Measure 110, stabilization services, Real D, SOGI, and mobile crisis are going to be included in that version 2 document and the corresponding data dictionary. They need both to make that happen. So yes. And we hope that this will, hopefully this will simplify folks' life somewhat. So we've been really trying, you know, we're trying to hit that target right in the middle. And Kayla and I and the rest of our Compass team have been great to help Kayla and I as we've reached out, our other folks. So we're really trying. So hopefully we hit the mark. Okay. I think we
Thank
can
you,
go on to
Jody.
the next slide. Yeah.
Yes, you are.
All right.
It's-
There we go. So as I mentioned in the upcoming slide, hopefully you've received this in the MOTS Messenger or another information that went out, but we are doing a roads provider update webinar, and these are the dates that are listed here. They are not this week, but next week are the 2 for EDI. There's some links, and I believe somebody has already dropped it in the chat. Kayla, amazing. Thank you. These are for you, your organization, anybody that you feel would like to learn about where we're at or what we're doing. You know, maybe you do the MOTS, but you've got a director, you've got a manager, a clinical, folk that want to join. They're more than welcome to register and join as well. The EHRs have also been sent this information. So they, I pretty much have gotten, like they will be in attendance. I don't know if your specific is, but I'm pretty confident Cloud, Ocean, Credible, Qualifax, and I would suspect that ReliaTrax will be there. So they'll be there as well. And if you feel like you have an IT person, or maybe you have a third party that does some consulting for you that helps you with your MOTS reporting, send it to whoever you think would like to join this. If for some reason Monday or Thursday of next week does not work for you, the 2 that say EDI, I would still recommend that you sign up for one of the CE ones, because there will be some information on both of these that is well relative to the project as a whole. And you will still get value out of it if you can't hit the 2 EDI ones. And if we find that we just have an overabundance and we have more requests, we will consider adding some additional ones. So,
Thank you, Jody.
we're gonna get, yeah, maybe get a sneak peek into the new system too. So that'll be exciting.
Ooh.
Yeah, Kayla was doing that yesterday. It was pretty cool.
Thanks, Jody.
Yeah.
Kayla, intro to MOTS.
All right. I'm sure this is when I sound like a broken record, because I know we talk about this every month, but I think it is a nice reminder so that folks who might be new to this position in their organization, new to MOTS reporting, or if someone's in this webinar and they're new to MOTS as a whole, we want you to know that there is a special webinar for folks that are just getting their feet wet with MOTS data or someone who may have been away from MOTS data for a while and is now, available and interested in learning how to do it correctly. Mary and I are typically the facilitators of this Intro to MOTS session. It happens the second Wednesday of every month at 10 a.m. I did not put the time on this. That was my mistake. And it's really just a more casual conversation about why we collect data in MOTS, what that data is used for. And then we do a little bit of clicking around in the portal to show you what MOTS looks like if the portal is something that you're going to be using. So feel free to join us. I'm putting the link to this webinar in the chat right now, and I'm putting the time so that folks know when it is. So I think we already have about 7 or 8 people signed up. So if that is interesting to you or some of your coworkers, please click the registration link in the chat. Thanks.
Can I add something to this one?
Of course.
Okay. So we have also found that this Intro to MOTS, I think Kayla might have mentioned this, but I know sometimes all of us, especially you folks that are tasked with doing the MOTS reporting and the files and the errors, and and sometimes you get staff that may be like, why are we doing this? It takes forever, like they may just might need a little bit of help understanding what it's about. And so what we've gotten for feedback is even existing folks that maybe are just confused, or maybe they're frustrated with the whole fact that they're having to do this, have really brought away a lot of value from this, because it really helps them understand how pivotal they are in this reporting and the actual funding and everything that gets pushed down to the client and made available. So I just wanted to put that out there, that even if they're not new and maybe they aren't even somebody who's doing the MOTS like you all are, but if they're having to fill it out, even filling it out within your own EHR, right? This is really helped. We've had some folks that we've done also this at like a dedicated staff meeting, or a time where they have their clinicians where they do and we'll come in and obviously virtually, but we'll speak to them, and we can kind of tailor some of this. We just know that and others that we've done this for have actually like recorded that. We've done it on like their Zoom. They'll record it, and they've even used it for like new employee onboarding. And it's really improved their reporting, the cooperation, just the collaboration that you all have with the people that are putting your data in your system. So I just wanted to put that out there, that is an opportunity that's available to all of you. And Kayla and Mary are doing a phenomenal job. I get nothing but just high praise and compliments. So there's
Thanks,
that.
Jody.
Excellent, Jody. Yeah. And for those of you who think, oh, well, I'll wait till Rhodes comes next year. No, please do MOTS, because everything that is currently in MOTS will be in Rhodes. So you have the basics. And then when the new system comes, you just have add-ons and you have your basic information there. And a lot of the principles that we're currently using will be incorporated in the new system. So you'll definitely have that base. So just FYI. Okay, Jody back again, switching from CE to EDI. Go ahead, Jody.
Yeah, and I'll just tag on to what Pete's saying. Really, don't wait. Even if you're going to a new EHR, they have MOTS functionality. Let's get it up. Let's get it running, because literally version 1 and version 2 are built upon existing version 1 fields that have codes and have things built into your EHR. We didn't go through those and change them all. We left what was there the same. So by all means, get plugged in. I know you all have got a lot of stuff going on. I've gotten some notifications from a few providers moving around with their EHRs. So yeah, which will be nice, because then you'll be familiar with it, and we won't hopefully they won't be redoing all of your forms, and however it works, it's going to be an extension. So the switching, this one says from CE to EDI, but this is really, if you're switching EHRs, maybe you're getting an uplift, a new platform that your EHR has put out, a new upgrade. Our biggest thing is just let us know. Number one, let us know if there is some sensibility, if we're getting really super close to MOTS go or Rhodes go live. But we'll talk about that. We'll make sure we know with you and your teams what is best timing for what you need to do. As with anything, when you're switching EHRs, if you're in the, where you're looking around at different ones, no one is better than another from our perspective. They all collect the data. They all meet our specifications if they've built the MOTS functionality into their system. So when you're looking, just, double check what's the business process, how's it work from end to end. And by end to end, like client comes in the door till it gets to MOTS, that kind of a thing. How much staff time will be required? There are still some steps that you do. And even when you switch from one EHR to another or go to an upgraded version of it, asking is always good, because then you can help align the expectations of even, yourself and your the folks around you that you are supporting. Project timing is super important, and we want to make sure with all of what we have going on here that we have the right resources and time allocated to fit your project. If you are going from client entry, if you're on here today and you're client entry and you're going to go to EDI, there's a process for doing this submission method switch, and we'll help you with that. I mentioned earlier the secure file transfer protocol setup, SFTP. You all, if you're using EDI already, you already have one. If you go to a new EHR, you still utilize the same directory. We don't set up a new one. And when we go from MOTS to Rote, you're going to keep the same one. So the next thing is client ID considerations. Usually when you switch systems, that's one of the first things they talk to you about. Like, are we changing them? What do you need to keep? Defining your business processes. This is kind of your thing, but should you need any, like, hey, what do others do? Like, have you heard any, pitfalls or opportunities? We can share things like that with you. All testing of files will be done through the EDI process. Even if you go with an EHR that already has functionality, we will still test your files to make sure that your configuration and setup is proper for what the MOTS file requirements are. You're going to go live, of course, which will be super exciting. And then the follow-up sessions, these are really, they're not mandatory, but we do offer them. And they're basically, yeah, you're live, that's great, right? But that now the real stuff kicks in, like you're submitting files, you're getting error messages into your EHR, or maybe you're getting the results file that you work and you have some questions. So follow-up can be weekly, bi-weekly, monthly. It can start frequent and sunset out. Just whatever it is, we want to make sure we're here for you to follow up and make sure your project is going well and your day-to-day operations are. And with that, I will wrap this slide up and kick it back to Kayla or Pete.
Thank you, Jody. Yeah, that kind of brings us to our usual ending, and it was a little bit longer than I expected. I thought we'd be done in 20 minutes, but no, we had a little more to talk about. So any questions?
Jody was long-winded.
That's okay. Pete. No, that was a lot to talk about, more than we thought. So, okay, is there anything in the chat? Any questions that we missed? I think Kayla put all the links that we talked about, and there's no limit to who can register for any of those sessions. It's all virtual, it's all in Teams, and I think I have not heard of a limit yet. So,
nope, no limits.
Excellent. Okay. If there's nothing in the chat, then as mentioned in the beginning, there's a recording of this webinar. Will be on our site pretty quick. We also send out messengers with updates and information and other links and helpful information. The next webinar will be December 6th, right after Sinterklaas. Signups are available, and thank you for joining us today. And the next one is our contact information. The next slide. Kayla. There we go. As you can see, everybody is oha.oregon.gov. Of course, the teams are a little bit different, but this is us. If you have any questions, anything that popped up, anything you missed, forgot, you know where to find us. And checking with my team, did anybody pick up anything? Did I miss anything? Did we forgot anything? Think we're good.
I think we got it. Yep.
Excellent. Thanks, Kayla. Thanks, everyone. Thanks everybody for coming, and have a wonderful rest of your day. Take care. Bye-bye.